Hello friend, welcome back to RJO Study One. Today we will discuss about case presentation on chickenpox. First page is identification data. Under identification data, name, date of birth, age, sex, developmental stage, admission time, date, ward, place of birth, gestational age, birth weight, name of birth, occupation, name of mother, family income, address, religion, diagnosis, informant relationship with child and language and come. Next is chief complaint. Under chief complaint, you have to write whatever baby's mother told. Now see, baby's mother complained that the skin of the baby was rashes and dry and also he has fever, running nose and cough since 2 days back. In that case, patient admitted in pediatric ward. Next is present medical history. Baby's mother noticed that the skin of the baby was rash and dry and also had fever since 2 days. After investigation, baby has been diagnosed as a chickenpox. Present surgical history. There is no significance of present surgical history. Past medical history. There is no significance of past medical history. Next, past surgical history. There is no significance of past surgical history. Next is family history. There are 6 members in the family. Baby's grandfather has been died and grandmother has healthy. Baby's father and mother both are healthy but malnourished. There is no having any past history of measles and there is no having any communication and hereditary disease. Next is family tree. You have to make family tree like this according to your patient. Next is socio-economic history. There are 6 members in this family and his father is only working member in this family. There is proper lighting, proper ventilation, proper water supply, proper electricity supply, proper sanitation and proper drainage. Next is family composition. You have to make family composition like this according to your patient. Next is birth history. Under birth history, first point is antenatal history. Under antenatal history, age of mother, married since, blood group, regular antenatal checkup, consumption of FSC and follicle acid, then TT injection, tetanus toxoid. Any exposure to sterogens, any complication. Then next second point is natal history. Normal delivery, after force, place of delivery, weight, condition of neonatal, mood of delivery, and BD, normal vaginal delivery. Any congenital deformity? No. Next, third point is postnatal history under birth history. First point is condition of mother, condition of neonatal, meconium passed within 24 hours, yes, passed urine, normally passed urine, any infection? No. Next, third point is feeding. Initiate of breastfeeding immediately after birth within 30 minutes. Next is sucking. Sucking reflex is good. Next is immunization schedule. At birth, BCG 0.1 ml, hepatitis C 0.5 ml, OPV O 2 drops, OPV 6 weeks under, OPV 1 2 3 2 drops, pentavalent 1 2 3 0.5 ml, then RNV 5 drops, measles rubella 0.5 ml, under 9 months Japanese encephalitis 0.5 ml, vitamin A 1 ml. Next is dietary nutritional history. Baby only taken breast milk, no other external food, breastfeeding given only 2 hours interval whatever required. Sleeping habit duration 18 to 20 hours daily. Problems related to sleep? No. Alimentation pattern? No, as urine frequency 20 to 22 hours low at bowel movement, 18 to 20 hours toilet train low. Communication and socialization. Mother communication good with patient but patient is not communicable with others. Response parents to child illness. Parental concept of diagnosis example. Response of parents to illness and fear. Reaction to fear of child to illness crying. Next is observation and assessment. Vital signs. Under vital signs, temperature, pulse, respiration and blood pressure is there. Next, anthropometric measurement. Head circumference 32 centimeters is normal. Chest circumference 31 centimeters is normal. Arm circumference 11 centimeters is normal. Height 48 centimeters is normal. Weight 2.6 kg is normal. Next is degree of malnutrition. It means how much weight of the baby. Next is refluxes. First one is rooting reflux, elated, sucking reflux, elated, chronic neck reflux, also elated. Next, Moro reflux, palmar crust reflux, stepping, placing or dancing reflux, Levinsky reflux, doll's eye reflux, Gallant reflux, palmar reflux, parental reflux, all are elated. Next is physical examination. Under physical examination, first one is general examination. Appearance, body build, activity, emotional status, and posture is there. Next, skin condition, skin color, texture, sugar, and elasticity and edema is there. Hair, hair color is black, distribution normally distributed. Next, nails, hygiene, condition, nail bed color. Next, head, head circumference 33 centimeters is normal, continency shape, shape is normal, condition is also normal. Next is eyes. Eyebrows is normal, eyelashes normally distributed, eyelid normal brownish color, shape and appearance of eye no sclera, normal color, conjunctiva no infected, cornea normal, pupils normal, lesion unidentified. Next is ear. Position. Top at the pira is on horizontal with the other contours of the eye. Shape and size normal. Hearing normal. Noise. Size is normal. Shape. Proper shape. Nasal septum. No deviation. Nasal flooring. Normal. Mouth and throat. Lips. Pink color. Color is normal pink color. Teeth. Most and of the present. Oral mucus moist. Gum. Pink color normal. Tongue pink color normal. Next is neck. Seaming of neck absent, thyroid is normal, lymph node is also normal, range of motion is normal maintained. Next is abdomen. Shape normal, inspection normal, no surgical site, palpation, stomach duration palpation, percussion. On percussion, no evidence of refer or air film in stomach. Auscultation, slow bowel sound. Back and spine is also normal and nature. Extremity. Upper extremity, range of motion is normal. Syndactyl, no syndactyl. Polydactyl, no polydactyl. Curling of finger, no. Clubbing of finger, no. Lower extremity, range of motion is also normal. Barlow sign is no discoloration. Ortholens sign, no dislocation. Next is genital. Rectum, normal. External genital, no abnormal. Penis is normal. Next is growth and development. Under growth and development, first point is biomedical development. Under biomedical development, height, weight, mid-arch circumference, antenatal, anterior frontal end is there. Second point is motor development. Third point is fine motor. Next, third point is sensory development. Next is psychosocial development. Next is spiritual development. Next is intellectual development. Next is moral development. Then language development. Next is play. Next is investigation. Bilirubin blood test, glucose test, ABO typing, CRP and CSB testing here. Next, medication. First medication is paracetamol, dosage 500 mg, root oral, frequently PID. Mechanism of action. Paracetamol has a central analgesic effect that is mediated through activation of dysentery serotonergic pathways. Contraindications: calories, undernutrition, liver problem, actual inflammation, acute liver failure. Indications: headache, migraine, sore throat, backache, rhythm, sick pain. Side effects: wheezing, tight chest or short travel, feeding, swallowing. Nurses' responsibility: nurses should provide proper medication in the proper time. Nurses should maintain proper documentation. Next medication is acetaminophen. Dosage 3.9 gram, root oral, frequently PID. Mechanism of action: the reduction of the COX pathway activity by acetaminophen is to inhibit the synthesis of prostaglandin in the central nervous system. Contraindication: severe active hepatic disease, hypersensitive curve, hepatic impairment. Indication: headache, minor pain of arthritis, cramps, muscular arch, fever. Side effects: red swelling skin, rash, hives, itching, swallowing of the face. Then nurses' responsibility. Nurses should check the expiry date of the medication. Next is anatomy and physiology. Anatomy and physiology. Chickenpox is a highly contagious disease caused by the virus zoster virus. It can cause an itchy blister-like rash. The rash first appears on the chest, back and face and then spreads over the entire body, causing between 250 and 500 itchy blisters. Next is disease condition definition. According to WHO, chickenpox is an acute, highly contagious disease caused by varicella zoster virus (VZV), a membrane of the herpes virus family. VZV transmission occurs via droplets, aerosols, and direct contact with respiratory secretions. Next, etiology. Varicella zoster virus, an itchy rash with small fluid blisters. Next is pathophysiology. Primary infection with varicella zoster virus, then varicella chickenpox, then latency, then reactivation, booster in herpes, then zoster, single, then vasculopathy, myelopathy, postherpetic neuralgia, then retinal necrosis, then peripheral. Next is clinical manifestation. Skin, blister, scab, ulcer or red spot, whole body, fatigue, fever or loss of appetite, also common, headache, itching, sore, hurt or swallow, lymph nodes. Next, diagnostic evaluation. Sign and symptoms, the typical stage of rashes and the appearance of different stages of rashes together are helpful in quick diagnosis. Lab diagnosis is usually not required, but if required, see are some cases. Pain clear from gesticular or serology tests for varicella, IgM antibodies, ELISA. ELISA test is also useful. Head-to-toe examination, biopsy test, antibiotic given, blood test, lymph node test. Next is nursing diagnosis. Hyperthermia related to viral infection, impaired skin integrity related to mechanical factors, disturbed body image related to lesions of the skin, prevent infants of microorganisms into the lesions, assess the degree of pain to avoid neurologic pain, do not delay the admission of pain relievers are prescribed, encourage sufficient bed rest and provide supportive care to promote proper healing lesion. Next is nursing process assessment subjective data. Baby's mother says that his skin is rashes and also having fever. Objective data and objective observation baby looks like restlessness, irritability, limited range of motion. Diagnosis disturbed body image related to lesion on the skin, deficient knowledge about the condition and treatment needs. Risk for infection related to lesions. Next is goal. Skin will stay clean, prevent the spread of the infection to improve fluid volume to the body. Planning. After 2 to 4 hours of nursing intervention, the patient will be free from the infection. Implementation. Assess the condition of the child, provide comfortable position, provide medication, irritable for comfort, check the vitals. Evaluation: after 4 hours of nursing intervention, the patient is free from any sign of the infection as evidenced by no fever, no inflammation. Second nursing process. Subjective data. Baby's mother says that he has crying too much, don't feed anything. Objective data. No objection. Observation. Baby looks tired and fatigued. Diagnosis: hyperthermia related to viral infection, risk for infection related to damaged skin tissue, impaired skin integrity related to mechanical factors. Goal: provide comfortable nursing care, administer medication as per doctor's order, check vital signs. Planning: after 8 hours of nursing intervention, the patient will demonstrate temperature with normal range and will experience no associated complications. Implementation: assess the level of pain, assess the nutritional state of baby, provide semi-solid solid tools, provide calm and quiet environment. Evaluation. After 8 hours of nursing intervention, the patient has able to demonstrate temperature with normal range of and experience no associated complication. Next is health education. Diet to educate the parents about the condition of the baby, advise the mother to provide nutritional food to the baby, advise the mother to provide fluid, example juice, medication, advise the mother to give medication on time and as per doctor's order, explain the mother about the side effects of health problem. Next is hygiene. Advise mother to change the clothes of the baby daily. Advise the mother to keep the surroundings of the baby body clean. Next is play and exercise. Advise mother to perform active experience exercise and encourage the child to play follow up. Advise the mother to come to hospital for follow checkup every week. Next is immunization. Advise the mother to take care and taken the vaccination on time for the baby. Next is conclusion. This conclusion you have to write yourself according to your patient like this. Next is bibliography. Bibliography also you have to write where you collect data. Under bibliography you have to write some books name like this. Thank you.